Can you hear me?
So, yes, I can hear you. Can you hear me?
Yes, sir.
So, well, friends, welcome to today's session. And today we have a very versatile personality who is uh, very well known to all of us in almost every conference of national health professional education, and a very famous person. And he's a Dr. Sanjiv Levin, and he's a professor of family medicine, pediatrics, medical education, and clinical ethics at St. John's uh, at St. John's Medical College, and he is the former chief of medical services at the St. John's Medical College. He is also the look at the extent. He is a adjunct faculty and clinical professor in medicine at the Center of International Health Education and Biosecurity in University of Maryland School of Medicine. He is a competent, passionate medical teacher, administrator, and clinical clinician looking for another challenge to excel and deliver quality work towards making a difference in healthcare delivery, especially through strengthening patient-centered systems and influencing learning-centered capacity building. He has a huge uh, biodata, and basically he's HOD pediatrics and also the HOD and convener National Center for Faculty Development and Medical Education and Clinical Ethics, uh, and as and also in administration. He is a board of administration and chief of medical services in his call, and also the executive committee of NABH and HOD medical education, pediatrics, and a large number of posts. So he'll be speaking on his journey today. And so, with this, we invite Dr. Sanjiv Levin to present his talk on his journey of joy as a medical college teacher. Over to you, sir.
Thank you very much, Dr. Sanjay Bedi and the MEU India. This is a journey of joy as a medical college teacher, and it is my honor to present this material as part of the late Rita Sood Memorial Oration. It's the 8th of February 2025. One second. In the pursuit of happiness, remember that the journey itself is what makes life beautiful. This is the time for me to tell stories from life, the lot of opportunities which I've had, and to thank so many who helped me on this journey. My name is Sanjiv Levin, and I'm from the St. John's Medical College and Hospital in Bangalore in South India. Like all other medical college teachers, my journey began as an undergraduate, internship. I did 2 years rural service, my post-graduation, and then worked as a faculty since 1993. My schooling was in a boarding school in St. Xavier's School, Jaipur, in 1973 to 81. And this gave me an opportunity to push my chest out and my chin up, because that's what I was taught in school. It was full of fun, full of learning. My entire 9.5 years I spent there. I joined undergraduation at St. John's Medical College, Bangalore in 1981 and fortunately finished on time in 86. St. John's Medical College, the first lesson was during orientation, which was called ragging in those days. When I was asked to catch a mosquito, assess the airway breathing and circulation of the mosquito, and resuscitate. If the bubbles did not come out when I tried to drown the mosquito, it meant the mosquito was not breathing. And I did ultimately do CPR on this mosquito, killing the mosquito in the end. The class of 81, there are formal pictures and there are informal pictures. And we've had a ball throughout our years, being a small batch of 60. Academics, as all of us are aware of, were part of medical school. But we were fortunate at St. John's because we had a lot of sports and athletics, hockey, basketball, and athletics. I even took part and won arrangement in flower arrangement and did so well that the next morning, when the lower limb viva was held in anatomy, I could not recognize the white, thick, cord like structure called the sciatic nerve. Fortunately, my anatomy professor passed me because it was this professor that gave us the first prize in flower arrangement. After 4.5 years, I entered internship and I was determined to do my rural service of 2 years after my internship, which was mandatory for us at St. John's. I chose postings in ICU, did an entire month in emergency, and did an elective in dermatology, knowing that they were important for me when I did my rural service. I remember trying to impress undergraduate students posted in emergency as an intern. This 60-year-old man was brought in with severe respiratory distress, was cynosed with pulses, paradoxes, and very muffled heart sounds. We lay him on the bed. I had a clinical diagnosis of pericardial effusion or tamponade. And since there was no time to waste, and being the senior-most person on the floor at that time, I put a needle into his chest attaching an ECG machine so that I could pull out a hell of a lot of pus so that the patient cyanosis improved, distress improved, and the pulses came back strongly. I then transferred him to the ICU, and need I say, the undergraduate students posted there were very impressed. I, of course, failed to tell them that I had cheated. I had seen cotton seals on bilateral chest walls and over the epigastrum, suggestive that somebody had already tapped this patient earlier. After my internship, I went to do my rural service in Khairabad and then later in Masuri Dasna in Uttar Pradesh. Khairabad is near Lucknow and Dasna Masuri near Ghaziabad. 2 years of learning how to be a doctor. A fabulous experience, especially since I had a very general surgeon, General the late Theobald Menezes, who would operate on anything, anywhere, at any time. It was under his tutelage that I grew as a doctor for 2 years. I remember this story of Chowdhury, a 70-year-old male who came to my clinic in the afternoon, late evening, complaining of worms in the nose. I had never heard of that, and I was diligent at that time. I took a detailed history, a past history, a family history. I did a general examination, examined the vital signs, and even did a full systemic review of RS, CVS, even CNS. I then picked up a torch to examine his nose and to look for the worms in the nose. And he looked at me strangely after 15 minutes of full examination and asked me why I was looking into his nose. He had worms in his nose, not his nose, but his cow's nose, and the cow was actually tied up at the entrance to the hospital where I worked. So I learned a lot of veterinary medicine, gave him turpentine and little bit of neosporin powder. He did come back 2 weeks later stating the patient was not better, but he said, at least I will try again. Two other episodes I can never forget is my general surgeon who for 200 rupees we would do cleft lip repairs in our operation theater. He had all the diagrams well drawn out, and we had a professor called Professor Norman Guido, who was a guru to my general and surgeon in the rural area. And we used to do cleft lip, sitting at the table looking at diagrams. I got a lot of gifts during my rural service, including pineapples, as truck drivers would stop next door to us, deliver pineapples from Assam to us only because we had looked after and saved his wife during a cholera epidemic during those 1989 days. Winters in UP can be very cold, and roads are fogged out for hours, making it difficult to transport patients. Our little mission hospital one day faced a 55-year-old security bank guard who was cycling to work, who developed severe abdominal pain, left hypochondriac, and developed hypotension, which I resuscitated with IV fluids and elevation of the leg end of the bed. I then decided, because we had a lot of duodenal ulcer in those days, that I needed to take an X-ray erect abdomen to look for evidence of perforation. I put him into a wheelchair and he collapsed, probably due to postural hypotension, a lesson learned for me. When I resuscitated him, he then complained that his pain was now all over the abdomen, especially over the left shoulder. And I remembered my Balian love, which told me to look for a possibility of a splenic rupture. We did a 4-quadrant tap, which was negative, and when my surgeon returned that evening, we decided to operate on the patient because by that time I had given 9 liters of fluid. We opened the abdomen to find massive, tense hemoperitoneum, and he nearly collapsed on the table with the aortic pulsations dropping. My general surgeon put his hand in and gripped the spleen, and I was instructed to do 4 cut downs immediately. I was good at cut downs, and I cut down both popliteal as well as the venous vein, and all the 7 sisters of ours, including the kitchen staff sister, came into the operation theater to help us. We scooped the blood from the abdomen, used gauze pieces, and put them into EDTA bottles to enable us to transfuse autologous transfusion of blood to save this patient because there was no blood. There was no movement on the roads to Delhi, which was 40 kilometers away. Need I say, we operated, shifted him to post-op room. 20 minutes later, I was called urgently to visit him because he was bleeding from his nose, his eyes were popping out, and he had a blood pressure of 180 by 100. We had forgotten to close the 4 IV lines, which are venisections. He had gone into fluid overload. We stopped all the fluid, gave him Lasix. He went home 2 weeks later, absolutely well, and we were so excited that we were able to save his life. Another but more sad story was during my rural service was a woman who came at term following massive antepartum hemorrhage, hemoglobin 2.3, winter, no blood available, unable to get blood. We waited for 6 hours. We had only 2 options to save the mother: do nothing or do something. And a young MBBS doctor and I, only 2 of us were there at that time, under local anesthesia, performed a C-section after explaining the risk and operated on the patient. We took out the baby, the bleeding did not stop. We used Datta to do all the steps necessary to prevent APH, ultimately undergoing a hysterectomy, remembering that Datta warned us that do not touch the ureters. Unfortunately, 3 hours post-op, this lady died. So we learned how to deal with successes and failures, but we had to do something to save lives in those days, especially in difficult circumstances. I returned after 2 years of tremendous learning and understanding that I was never going to be a surgeon, that I was going to be a physician of sorts. I worked in gastroenterology as a senior house officer for 6 months, and my teacher was Patrick Kamath, the boss, a wonderful teacher. Some of you all may recognize him as being the head of hepatology at Mayo Clinic and the author of the Mellard score, which determined the prognostication for liver transplant. It was he who taught me Sengstein taken Blackmore tube insertion, and I was the man Friday in St. John's in the hospital, going around and using the Sengstaken Blackmore tube to resuscitate and stabilize varicose bleeds who used to come in hordes in those days. I then got into post graduation in pediatrics, which was exciting because I thought I was definitely getting medicine, and pediatrics was a dream come true. I studied Nelson every night on my duty nights, and I read the pediatric clinics of North America throughout my years to learn because they were so beautiful, those books, written so well. It was a joy doing St. John's, doing my post graduation, especially since I had returned to my alma mater, the St. John's Medical College and Hospital. I will forever be indebted to my teachers like Dr. Malti Yashwant, Dr. Swandareka Bhatt, the late Dr. M.K. Chandrasekhar, and of course, Dr. Subbarao. They taught me about having a heart. They taught me perfection and sticking to detail. They taught me about patience and joy of teaching, and I'd always remember them for this. It was during my post graduation that I completed 8 papers published, and it was exciting because it was all about observation. In 1991, on duty over a period of 1 to 2 months, I saw on my duty nights 4 young girls between the ages of 4 and 8 years who all presented with a saddleback biphasic fever with vague symptoms of headache and body ache. All of them came in with shock, had petechiae, had thrombocytopenia, and on the right side of the x-rays, all of them had pleural effusions. We were amazed that we had these 4 children, all from the outskirts of Bangalore, not from Bangalore, on the main highways. And it was only 2 months later, while waiting for rounds, that I opened a big old Nelson textbook and it fell open to the middle pages. And that particular middle page of Nelson textbook had some topic called dengue. We had never heard of dengue, and this report became the first description of dengue in Bangalore city. And we are extremely proud that we were able to observe simple case series and raise the issue, the flag about the potential of dengue, which is now day bread and butter, is daily routine for all of us. We also did studies during resistant typhoid fever, where we documented acute acalculous cholecystitis, which was exciting as a young postgraduate growing up. My baptism as a teacher began as a young lecturer when I was given opportunities to participate as a faculty in pediatric advanced life support. I was very good with the Heimlich and the basic life support, full of activity and full of fun. I had wonderful teachers, and you can see in this photograph some doyens of pediatrics, including Dr. Sunit Singhi, Dr. 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 Kamla, KG Kamla, and Dr. Nalini, not forgetting so many others who still exist today. General pediatrics was exciting. Every station on my journey of general pediatrics began with hematology, nephrology, where I learned to do peritoneal dialysis, and I would do peritoneal dialysis in all children in St. John's, being the first pediatrician outside nephrology to do that. I looked after and I enjoyed pediatric intensive care, doing exchange transfusions for severe malaria because of hyperparasitemia, no longer done that much or ever done in this day and time. Neurology, I learned a lot of neurology working with Dr. MKC Nair and came back with put a mattress in my outpatient room, and I would teach mothers sitting on the mattress Vochta therapy so that they would improve like occupational therapy, improve their babies' development milestones. Infectious disease remained my first love with dengue, HIV, molluscum, histoplasmosis, and of course, of late, scrub typhus, which grew in the last 10 years. I was very fortunate because St. John's Medical College allowed me to begin disaster relief, my dream of saving lives. I participated in two main cyclones, Bangladesh and Orissa. I took teams into Latur and Gujarat for earthquakes. I also participated in the Kashmir floods and took teams all the way to the Nicobar Islands for the South Asian tsunami of Boxers Day. Uh, this is a legacy that St. John's has begun in 1971 and continues to date, much less so now because of the formation of the National Disaster Management Authority. We would have volunteers in St. John's from across the institution, amounting to nearly 67 to 100 volunteers within 2 hours of announcing our team. We would have realize that relief is beyond medicines because every disaster taught us that it's not about medicine and health alone, it's about nutrition and shelter which matters. Latur Kilari taught me the importance of secondary disasters being created when you move populations into makeshift shelters, making it different, and community health measures became so important to save lives. The Kashmir floods taught me the importance of accessibility to health because we were dealing and working in difficult areas where inequities were quite obvious. But my favorite response was the tsunami where I felt good. We reached the Nicobars in 48 hours after the tsunami. We traveled from Port Blair to the islands of the Nicobars, 120 kilometers away from Indonesia, the epicenter, on board the destroyer, the Indian naval ship Rajput to Kamorta. It was here that we realized that we were at a secret naval base which was observing traffic through the Malacca Straits. We traveled 12 hours overnight at 25 knots. We saw our first patient on board who was brought on board with a dislocated shoulder and a fracture of the humerus. We helped offload supplies and pulleys to the island of Kachal, and we continued to do what was necessary. We were airlifted by Chetak helicopters onto the islands. A group of 8 of us were there, and we stayed in temporary shelters which already existed on the higher areas of the islands, helping them cope and looking after them with evidence to clear water and sanitation. Of course, we had to deal with irrational supplies, and that's one lesson learnt again. We trekked from camp to camp, as can be seen by some of the team photographs, and we also went by Gemini from island to island. It was here that we had to swim all the way to submerged jetties and onto the beach of an island because it was at Teresa Island where the team was stranded, and we had to swim back to inform and give information of how to leave the island because the ships were coming on the opposite side, unable to berth at this regular area. We helped splint fractures, and this is an ophthalmological postgraduate who's now in Australia as a consultant, who's splinting a fracture, restraining the spine, and we helped arrange for transfers as makeshifts. Teamwork was excellent. You learned so much working in the field in these disasters. And that led me to my another love, which is medical education. My medical education began in 1994, and my team, and of course, the existing team exist. A wonderful team at St. John's, enthusiastic and dedicated and highly motivated to teach medical education. And you can see that it was in 2007 how we grew from strength to strength with our programs, beginning with the MCI Regional Center, finally becoming a nodal center, and doing so many different things as we go along. We learnt about friendship, and even though I never spoke to them throughout MBBS, being 1 year junior to me, some of my best friends turned out to be Dr. Sunita and John Stephen. And what bound us together was a love for medical education, quality of education, and teaching. My favorite session used to be assessment, probably because Dr. Tejinder Singh was one of my gurus. And I would wear a paper cap or a paper crown and insist on being the king because we all know that assessment is king, come what may. We took pedagogy and mentorship to Africa. We trained the University of Nairobi in Kenya. We trained the University of Nigeria in Lagos and also did work in Botswana, which was a great decision for us. Clinical ethics was also part of my journey. I learned a lot of ethics from Dr. G.D. Ravindran, who's presently my boss at Family Medicine, and had an opportunity of training at the Georgetown University for a short time, under Dr. Edmund Pellegrino, who is late, of course. And I did clinical ethics of 1992. My next little journey was in crisis management when I was head of pediatric intensive care because we had lost our intensive carist for a period of 2 years for various reasons. In 2009, I headed the pediatric intensive care and we got hit for the first time with H1N1. The patient I looked after was ventilated for 69 days. This young 8-year-old girl was the first diagnosed H1N1, at least in St. John's, if not in Bangalore. This little girl took me through every chapter in Rogers' textbook of critical pediatric care, took me through complications of respiratory, took me then to cardiovascular abnormalities, took me to surgical, neurological abnormalities, took me through renal failure, septicemic shock, and endocrine failures. Fortunately, one after another, so I was able to cope with the issue. I would beg the parents, incidentally, a staff kid, to take the patient to a more sophisticated unit with qualified intensivists. But for some reason, they stuck with us. 69 days on ventilator. This young lady, I'm proud to say, just completed an internship at St. John's and, and has left my department of pediatrics, continuing her journey, and probably in 3 to 4 months will graduate as a doctor. A wonderful experience learning from this little girl who's now a young, great doctor. My crisis management continued because in 2021, I was the chief of medical services of the St. John's Medical College Hospital, 1,500 bedded, when COVID 19 hit. We had no clue about COVID 19. We even ran out of sanitizer and PEPs. And my present director, who was associate director of finance, actually helped us make and tailor make PEP by traveling all the way to Coimbatore to pick up material for PEPs. We also made the biochemistry department also learn to make a disinfectant for us, and we survived. Massive teamwork took place, over 30,000 in fever clinics, over 40,000 vaccines, over 15,000 emergencies, and over 18,000 ICU ventilated admissions, with mortality overall of 8.2% and ICU mortality of 36 to 47%. We were proud because all of us as a department, right from the physiologist to the psychiatrist to the ophthalmologist, helped medicine run the show. We learned so much in the first wave and the second wave. We even ran a war room which smoothened out all our problems of the first wave, and we cannot thank the leaders of the team which developed that. The sabbatical was my booster shot in 2005 as a young doctor. I joined the Institute of Human Virology, the University of Maryland, and I operated in Africa, 6 countries in Africa, and Guyana in the Caribbean. My bosses were Robert Redfield and Rob Schenenberger. You may recall that Redfield became the CDC head for a short period of time before the change in government. Africa was beautiful. I learned so much I would never return. Our journey used to be on SUVs, traveling miles, even going through forest fires. I would go on catamarans on the Zambezi River full of crocodiles, fly in small Cessnas as a young doctor, landing on strips which were actually river beds. so it cannot be more exciting than it got. Landing up in rural hospitals in Africa with very few doctors, doing pediatric ART, had to do adult ART, deal with opportunistic infections in resource constrained settings, and using my clinical skills to teach in clinics on rounds using simple x rays, pulse oximeter, 6-minute test, and using Skype to telemedicine and get support for whatever I do. The clinics in the bush included training clinical officers who've done 3 years of medicine, eager to learn, but they were fabulous and they ran the clinics. There were nurses who I trained in IMNCI and a lot of aides and helpers who would take part in the training. It was a community disease, and only together we could do something about it. Met a lot of amazing people, including many Indian missionaries in those areas working in hospitals in God-forsaken places. And of course, ended up meeting a senior of mine from medical school, a 1965 batch, Dr. Sister Flavia, who was working in Africa for 30 years before I reached. And it was amazing because I was a Johnite and here was my senior in this mission hospital. I worked with the UHO, the WHO, not only in medical education doing a fellowship, but also helping in the pediatric blue book for hospitals, HIV, OI guidelines, cryptococcus, and education. I was fortunate because back in India, NACO, and I continue to assist NACO in pediatric ART, and was given a opportunity to help Timur Leste in HIV, hepatitis B, and syphilis. The reward was obvious. Happy children, happy patients came back 2 years later with a booster shot of wanting to be a doctor. I was able to assist the Michelin company to create a mobile clinic where Susan Abrahams Forard created a bus where my young graduates from St. John's began their rural service doing clinics in 31 hamlets in Tiruvallur district of Tamil Nadu. Education, minor procedures in this mobile clinic, and wonderful young doctors enjoying the 2 years spent there. And as one can see, it has been a journey of opportunities. And before I end, I'd like to salute those who started me on this medical education journey. My medical education's gurus remain Dr. D.K. Srinivas, ex-JIPMA Pondicherry NTTC, now Bangalore based, and of course our dear Dr. Avinash Supe, who's my guru and gave me my first medical education book signed by him. I went on to realize that I had many other master teachers of teachers throughout my years, including Dr. Tejinder Singh and Dr. P.V. Chalam, who's kind enough to be listening in to this little this opportunity given to me. I then continued to remember, and I wish he was my teacher, but through his books, even though it's war and 100 years ago, is of course Sir William Osler, who kept reminding me that medicine is not an art. It is an art, not a trade, a calling and not a business. It is he who told me that the phenomenon of disease without books is to sail an uncharted sea, while to study books without patience is not to go to sea at all. And remembering that his third quote is so important today when people are ordering panels of investigations which cost so much money, where he said over 100 years ago that we are entering a realm of certainties where certainties are replaced by probabilities. Nothing without the support and love of my family, my parents, without which nothing would have been possible. And of course, in the 1990s, I asked a friend, how does one become rich? And I was told by this friend, a dermatologist and an educationist, that I was told to marry a rich girl. I did marry a rich girl, but I was conned. She was rich at heart, and my son, of course, is now 22 years, a wonderful young man. And thank you so much, both of you all, for the support going through. I thank you all for this opportunity to share my joy. Thank you very much. Over.
Thank you, Sanjeev, for this excellent talk. I mean, it is a long journey, and you are full of enthusiasm for each step. That shows the joy of your journey as in medical education. And we have also reached the number of 97 listeners, which is quite, which is very rare. That this shows how much your friends are who have joined, and everybody is enjoying. So, with this, we are honored uh, to present to you we are honored to present to you, sir, this Rita Sood Memorial Oration. And with this, we end this beautiful, enthusiastic, joyful journey which we have just enjoyed. Thank you, sir.
Thank you very much, Dr. Sanjay Bedi, Dr. Tejinder Singh, Suchitra, and of course, my dear Dr. Nirmal Rege. Thank you very much for this opportunity.
Thank you, sir.